Hello everyone and welcome back to my channel. Today we'll be going through the part 7 video of the NACC PSW practice questions and answers. We're starting right off with question 1. What is the appropriate action for a support worker to take prior to moving a heavy object? A. Bend from the waist. B. Hold the load away from the body. C. Lift the object above the chest. D. Bend at the hips and knees. In option A, bending from the waist will put a strain on the lower back and you can end up injuring yourself as a support worker. In option B, holding the load away from the body will increase the pressure on your spine and cause injury. In option C, lifting the object above the chest is unsafe and it can even cause a loss of balance. Before moving or lifting a heavy object, the correct technique is to bend at the hips and knees and not the waist. So that would be option D. Bending at the hips and knees allows the leg muscles, which are stronger, to do most of the work while keeping your back straight and reducing the risk of injury. So the correct action would be bending at the hips and knees. Question 2. A client with advanced dementia cannot speak but begins to moaning and pulling at her blanket. What should you do? A. Tell her to stop making noise. B. Assume she's cold and add another blanket. C. Check for possible causes of discomfort and report to the nurse. D. Ignore her because she can't communicate clearly. Telling her to stop making noise in option A is disrespectful and it ignores her needs. In option B, assuming that she is cold and adding another blanket can worsen the situation if the cause is something else like pain or overheating. A client with advanced dementia may express pain, discomfort, or distress through nonverbal cues such as restlessness, pulling at objects, or moaning. As a support worker, you should investigate possible causes. So it could be pain, hunger, wet clothing, being too hot or cold, and reporting your observations to the nurse for further assessments. In option D, ignoring her neglects her well being and may allow distress to continue. So the best action to take is option C. Check for possible causes of discomfort and report it to the nurse. Question 3. A dying client asks you to pray with them before they sleep. What should you do? A. Politely decline because it's not your role. B. Say a short prayer or sit quietly with them if you're comfortable, respecting their wish. C. Tell them to wait for the chaplain. D. Change the subject to avoid emotional topics. In option A, while prayer isn't a job requirement, refusing may seem insensitive and fail to meet the client's emotional needs. When a dying client requests prayer, it is an expression of emotional and spiritual need. So if you're comfortable, you can join them in a short prayer, or you can simply sit quietly in support. This shows compassion, respect, and empathy. It also helps to provide comfort and dignity in their final moments. In option C, telling them to wait for the chaplain may delay comfort. A chaplain can be called later, but immediate support matters the most. In option D, avoiding the client's emotional request can make them feel alone or dismissed. So, out of these options, the best action to take is option B. Say a short prayer or sit quietly with them if you're comfortable. And in doing so, you're respecting their wish while showing compassion, respect, and empathy. Question 4. Two family members are arguing loudly at the bedside of a dying client. What is the best action? A. Ignore them since it's a family matter. B. Join the argument to defend the client's comforts. C. Ask them to step outside and inform the nurse of the situation. D. Leave and continue your other duties. In option A, ignoring them neglects your duty to protect the client's comfort and emotional well being. Joining the argument in option B is unprofessional and this can escalate the situation. When family members argue near a dying client, it can cause stress and discomfort for the client, and it also disturbs the peaceful environment needed for end of life care. In this situation, the best response is to calmly ask them to step outside to prevent further distress and then report the incident to the nurse so that appropriate support or mediation can be provided. In option D, leaving, um, like walking away, leaves the clients in a stressful situation and fails to ensure their safety and comfort. In this case, the best action to take is option C. Support workers should always advocate for the client's peace and dignity, especially in emotionally sensitive end of life situations. Question 5. Mr. Dawson refuses to take his prescribed medication. What should you do? A. Try to hide the medication in his food. B. Respect his decision and report the refusal to the nurse. C. Tell him you'll call his family if he doesn't take it. D. Leave the medication by his bed. Hiding the medication in Mr. Dawson's food is unethical and this can be considered abuse or a violation of trust. Clients have the right to refuse medication or any form of treatment as long as they are mentally capable of making that decision. Your role as a support worker is to respect their choice, not deceive them or force them. What you can do is to report the refusal immediately to the nurse so that appropriate follow up or documentation can be done. In option C, threatening to call your family is unprofessional and coercive. And in option D, leaving the medication by his bed is unsafe because he may take it incorrectly or not even take it at all. So the best action will be option B. Respect his decision and report the refusal to the nurse. Question 6. A nurse asks you to help with a new procedure for a client, but the client seems confused and unsure. What should you do? A. Ask the nurse to confirm that informed consent has been obtained. B. Proceed with the task since the nurse gave instructions. C. Explain the procedure yourself. D. Do it quickly to avoid distress. Before any medical procedure, informed consent must be obtained from the client. This means that the client understands what will be done, why it's needed, and the possible risks and benefits. If you notice that the client seems confused or unsure, it can indicate that consent might not be properly obtained or that the client is incapable of giving it. As a support worker, you must not proceed. You should ask the nurse to verify that consent is in place before assisting. In option B, proceeding with the task is unsafe and unethical because the client's rights must be respected. In option C, explaining the procedure yourself is outside your scope of practice because only licensed staff should obtain informed consent. In option D, doing it quickly to avoid distress violates the client's right to autonomy and understanding. So, the correct action to take is option A. Ask the nurse to confirm that informed consent has been obtained from the clients. Question 7. Mr. Roberts, who has mild dementia, can still feed himself but does so slowly. You are behind schedule. What should you do? A. Feed him quickly so you can move on. B. Allow him eat at his own pace, offering assistance only if needed. C. Remove the food when time runs out. D. Skip his meal and record it as refusal. Option A disrespects Mr. Roberts' independence and it can cause frustration or even choking. Even though Mr. Roberts has mild dementia, he still has the ability to feed himself. So, allowing him to feed himself supports his independence, dignity, and self esteem. It also helps to maintain his fine motor skills and sense of control. As a support worker, your role is to encourage independence while ensuring safety and adequate nutrition. So you can offer help only if he struggles or he requests assistance. Option C can lead to malnutrition and neglect, and option D is unethical and inaccurate. He did not refuse to eat. So, skipping his meal and recording it as a refusal is unethical. What you should do is option B. Allow him time to eat at his own pace and offer assistance only if it is needed. Question 8. A terminally ill client tells you they're scared of dying. What is your best response? A. Change the subject to avoid upsetting them. B. Tell them not to worry because everyone dies eventually. C. Listen empathetically, acknowledge their fear, and offer to call the nurse or chaplain. D. Tell them they should be strong. In option A, changing the subject dismisses their feelings, and this can make them feel unheard and alone. In option B, while telling them not to worry because everyone eventually dies minimizes their fear, it doesn't offer any emotional comfort. When a terminally ill client expresses fear of dying, the best response is to listen with empathy and compassion. Acknowledge their feelings so you can say something like, it's understandable to feel scared. Also, provide emotional support. You can offer to call a nurse or a chaplain or a counselor who can provide additional comfort and guidance. In option D, while telling them to be strong is well intentioned, it ignores their emotional states and it can make them feel pressured to hide their true feelings. So, your best response in this scenario would be option C. Listen empathetically, acknowledge their fear, and offer to call the nurse or chaplain. Question 9. Mr. Lau has dementia. Which of these options describes dementia? A false belief. B. A loss of memory caused by changes in the brain. C. Seeing, hearing, or feeling something that is not real. D. A disease that causes progressive loss of balance and coordination. Option A can best be described as a delusion, not dementia. Dementia is a general term that describes a progressive loss of cognitive functions like memory, communication, and reasoning, and this is caused by physical changes or damage in the brain. It affects daily functioning and it can get worse over time. In option C, this describes a hallucination and it can actually occur in dementia, but it doesn't define dementia. In option D, this best describes Parkinson's disease and not dementia. So, out of those options, the one that describes dementia best is option B. Dementia is a loss of memory caused by changes in the brain. Question 10. Moving a body part towards the midline of the body is A. Extension, B. Rotation, C. Abduction, D. Adduction. Extension is straightening a joint or increasing the angle between two bones. For instance, when you straighten your elbow, that is an extension. Rotation is turning a body part around its axis. For instance, turning your head from side to side. Abduction is moving a body part away from the midline, such as lifting your arm to the side. That is abduction. While adduction means moving a body part towards the midline of the body. So, for instance, bringing your arm back towards your side after lifting it out. So, our answer here is option D. Adduction is moving a body part towards the midline of the body. So, don't mistake it with abduction, which is moving the body part away from the midline of the body. Question 11. What is hypothermia? A. Very low body temperature. B. Bluish discoloration of the skin. C. Moist cold application. D. Very high body temperature. Hypothermia occurs when the body loses heat faster than it can produce it, causing the core body temperature to drop below 35 degrees centigrade or 95 degrees Fahrenheit. This can be life-threatening if it is not treated promptly. In option B, the bluish discoloration of the skin describes cyanosis, which can result from hypoxia, but is not hypothermia itself. In option C, moist cold application is a method that can be used therapeutically, but it is not the definition of hypothermia. While option D describes hyperthermia or fever, that is very high body temperature, and this is the opposite of hypothermia. So our answer here is option A. Hypothermia is very low body temperature. So you can look out for signs like shivering, slow breathing, confusion, and pale or cold skin in hypothermic patients. Question 12. Agitated and restless behavior may be the result of A. Pain or discomfort, B. Too much stimuli, C. Lack of sleep, D. All of the above. Agitated and restless behavior in clients can be caused by multiple factors, and this includes pain or discomfort, lack of sleep, too much stimuli, that is noise, crowds, or a chaotic environment, which can overwhelm them. So, the first three options are all a result of agitated and restless behavior. So, our answer here is option D, all of the above. Question 13. Which guideline for bathing a client is correct? A. Clean the perineum first. B. Encourage the resident to help. C. Rub the skin dry. D. Use cool water at all times. Option A is incorrect because standard hygiene practice is to wash the face and body first, then the perineal area last to prevent bacteria from spreading. Option B, encouraging the resident to help promotes independence, which is important for their dignity, autonomy, and maintaining strength. Option C, this would be incorrect. Skin should be patted dry gently, not rubbed, in order to avoid irritation. And in option D, this is also incorrect. You should use warm water, not cold, for comfort and safety. So our answer here is option B. Question 14. The most common IV site is the A. Lower leg or thigh, B. Internal jugular vein, C. Lower arm or hand, D. Subclavian vein. Option A is rarely used in adults. It's only used in emergencies or for infants. In option B, this is used for central venous access, not routine IV therapy. The most common site for peripheral IVs, because the veins are easily accessible, is on the lower arm or hand. In option D, the central line site is used in hospitals for long-term or critical access. So the most common IV site is option C, the lower arm or the hand. Question 15. Mr. Roberts insists he sees people standing in his room, but you see no one there. What should you do? A. Argue and tell him he is imagining things. B. Listen calmly, avoid confirming or denying, and reassure him he is safe. C. Laugh and tell other staff about it. D. Leave immediately without responding. Option A can increase fear, anxiety, or agitation, so this should never be done. In option B, listening calmly, avoiding confirming or denying, and reassuring him he's safe validates his feelings without reinforcing hallucinations, and it also maintains safety. In option C, laughing and telling other staff about it is unprofessional and disrespectful, and this can harm trust. In option D, leaving immediately without responding ignores the client's distress and could escalate fear or confusion. So, what you should do as a support worker is option B. Listen carefully, listen calmly, avoid confirming or denying, and reassure him that he is safe. Question 16. Identify the measure that supports oxygenation. A. Encouraging coughing and deep breathing exercises. B. Allowing the client to rest in the same position for 4 hours. C. Positioning the client in the semi-Fowler's position. D. Assisting the client to use an incentive spirometer. In option A, coughing and deep breathing exercises helps to expand the lungs, remove secretion, and improve oxygen exchange, thereby supporting oxygenation. In option B, staying in one position can reduce lung expansion, and this will increase the risk of pneumonia and even impair oxygenation. In option C, while staying in the semi-Fowler's position can help improve breathing, on its own, it is less effective than active measures like deep breathing. In option D, using an incentive spirometer also supports lung expansion and oxygenation. However, in the context of basic measures, encouraging coughing and deep breathing is a standard supportive measure that is taught to all clients. So, the best answer here is option A, encouraging coughing and deep breathing exercises. Question 17. Mr. Lee is unsteady on his feet when walking to the bathroom. What is the safest approach? A. Let him walk alone to maintain independence. B. Assist him with a gait belt and stay close by. C. Carry him to the bathroom. D. Ignore it and hope he doesn't fall. Option A is unsafe and it increases the risk of falls. In option B, using a gait belt provides supports and helps to prevent falling while promoting safe mobility and some independence. In option C, carrying him to the bathroom is unsafe and inappropriate because this can injure both the caregiver and the residents. In option D, this is also unsafe and it is neglectful. The best answer here is option B. Assist them with a gate belt and stay close by. You should always prioritize resident safety while supporting their independence. Question 18. You notice a resident has a foul odor and dirty clothing but refuses to bathe. What should you do? A. Offer a sponge bath and involve the residents in the process. B. Argue and insist on immediate bathing. C. Ignore the hygiene issue. D. Punish the resident by restricting activities. For this, we'll be going with option A because this respects the residents' dignity and autonomy while maintaining hygiene. Offering them the choice of a sponge bath can also increase their cooperation. Option B can cause resistance and distress. Option C is a neglect of their hygiene, and this can lead to skin problems, infections, and even discomfort. Option D is unethical and harmful. PSWs should promote care, not discipline. So our answer here is option A. Offer a sponge bath and involve the residents in the process. Question 19. A resident with hearing loss appears frustrated during conversation. What is your best response? A. Speak louder without facing them. B. Use short, clear sentences and face them directly. C. Ignore their frustration. D. Move on to another resident. Option A. Speaking louder alone is often ineffective. Lip reading and visual cues are important. So, the correct thing to do is to use short, clear sentences and face them directly. This will ensure that the residents can hear and understand, thereby reducing their frustration and promoting effective communication. Ignoring their frustration in option C can increase their anxiety and confusion. And moving on to another resident in option D avoids addressing their needs, and this may make them feel neglected. So, the best response here is option B. Question 20. After assisting a resident with toileting, you notice a tear in your gloves. What is the correct action? A. Finish the task and wash hands later. B. Wipe the gloves with a towel and continue. C. Ignore it because you are careful. D. Remove gloves, wash hands, and put on new gloves. Option A increases the risk of infection and contamination. Option B does not eliminate pathogens, and this is unsafe. Option C is totally unsafe because a torn glove compromises protection. The best action to take is option D. Remove the gloves, wash your hands, and put on new gloves. This follows the standard infection control procedures to protect both the resident and the caregiver. Any tear or breach in gloves requires immediate removal, hand hygiene, and replacement in order to prevent the spread of infection. Question 21. Mr. Ahmed grimaces and holds his shoulder after a fall. What is your first action? A. Give him pain medication immediately without assessment. B. Tell him it's not serious. C. Ask him to rate his pain and report to the nurse. D. Ignore it and continue other tasks. In option A, PSWs cannot administer medication independently without proper assessment and orders from either a nurse or a doctor. Option B dismisses the resident's pain and it may increase anxiety. Assessing pain and communicating it to the nurse ensures appropriate. In option D, Ignoring it and continuing with other tasks is neglectful and unsafe, and it could worsen the injury. So, the best action to take here is option C. Ask him to rate his pain and then report it to the nurse. You should always assess pain, document observations, and report it promptly to ensure that the resident receives proper care. Question 22. A resident complains of dizziness while walking. You should A. Encourage them to walk faster, B. Stop, assist them to sit and monitor for safety, C. Ignore and continue, D. Send them to their room alone. In option A, this can increase the risk of falling or injury. The correct thing to do is to stop, assist them to sit, and then monitor for safety. This ensures immediate safety, prevents falls, and allows assessment of the resident's condition. Option C is neglectful and unsafe. And option D is totally unsafe because sending them to their room alone is not it. A diesel resident may fall and injure themselves. So you should always prioritize the resident's safety by stopping the activity, providing the support, and monitoring when symptoms like dizziness occur. So we are going with option B here. Question 23. You notice a wet floor near a resident's bed. The best immediate action is A. Clean it up promptly or place a warning sign and notify staff. B. Ask the resident to be careful. C. Ignore it. D. Wait until the next shift. For this, we'll be going with option A. This will prevent slips and falls, and it also follows safety protocols. Any other option there is unsafe. The best option is option A. Question 24. You notice a resident has foul smelling urine. You should A. Report the observation to the nurse, B. Ignore it, C. Tell the resident it's embarrassing, D. Clean them and say nothing. Reporting the observation to the nurse is the correct step to take because foul-smelling urine can indicate infection or other medical issues. So the nurse needs to assess and intervene. In option B, ignoring it neglects the potential health concerns of the clients. In option C, telling the residents it's embarrassing is disrespectful and it can cause emotional distress. Option D addresses hygiene alone but not the underlying medical issue. So the best course of action is option A. Always report changes in a resident's health or unusual symptoms to the nurse promptly while maintaining the client's dignity. Question 25. A resident with a cold sneezes into their hand. You should A. Ignore it, B. Provide tissues, encourage hand washing, and follow hygiene protocols, C. Scold them, D. Remove them from the room. Option A increases risk of germ transmission. Option B, this follows infection control standards and it will protect both the resident and others around that environment while teaching proper hygiene. Option C is unprofessional and unhelpful, and option D is unnecessary. Proper hygiene measures are sufficient. So the answer here is option B. Provide tissues, encourage hand washing, and follow hygiene protocols. This brings us to the end of the practice questions and answers for the NACC PSW certification exam. This is the part 7 video. If you've not watched the other videos, you can check the playlist. We have parts 1 to 6 there, and this is a part 7 video. Don't forget to like, comment, and share, and also hit the subscribe button so you'll be notified when our next informative video will be dropping. Thank you for watching, and I'll see you in the next one.